Hi, and welcome to another PSCA Roundtable. I'm very fortunate enough that I wanted to have a very deliberate conversation about supporting students in schools and especially student mental health. So I have two of my favorite colleagues here to talk currently from their areas of expertise and not specifically in their roles in the state, to really talk about how we can best support students in their mental health, both during and through and the return to from school closures. With that being said, I'm going to let them introduce themselves right now. Dan, why don't you go?
Hi, I'll go. I'm Dana Milakovic. I am currently the mental health, alcohol, and other drug specialist with the Department of Education, and I also lead the trauma work for PD.
And I'm Perri Rosen. I am a consulting psychologist with the Office of Mental Health and Substance Abuse Services under the Department of Human Services. And I've worked primarily on youth suicide prevention grants through our office.
So I think just getting started, one of the questions I had, which I've been asking everyone, is just that basic question. At least through your lens, what are some of the biggest concerns you have for students now during the school closures?
One of the concerns that I have, and I know this comes partly from focusing so much on trauma, is that this really is a chronic thing that families and students cannot control. So we can't control this situation, and that increases our stress levels, and stress can be really toxic. So increased anxiety about getting sick can actually make you sicker because your immune system is down and your brain is kind of hijacking, your emotional brain is hijacking your thinking brain, and so you're not doing things that you would normally do or that we would consider common sense. So there's a lot of stress about getting sick, and it's helping it's helping keep us safe, but it's also helping us deplete our immune system, basically, and that we don't know what's happening in the student's home. So when you have all of that stress and you add it onto other stressors that already exist around food insecurity and changes in pay and reduction in the job force, you're really increasing stress levels at home that are affecting the mental health of our families, our parents, and our students, and that really cycles together. And that's one of my main concerns I think that I've had.
I have to be honest, I've been having a lot of these conversations, both recording and not recording. That's the first time that came up, but I feel like that's excellent feedback. So I really appreciate you sharing that. Perri, what are you noticing?
Yeah, I mean, I think something else that we probably already have on our radar is those students that might have already been struggling with mental health issues or substance use issues even before all of this. And so certainly some of the issues that Dana just mentioned, could potentially be exacerbating some of those issues right now. And a lot of those students, just because of the fact that, we're not in school, we're not in our typical routines right now, there may be other interruptions in some of the natural supports, as well as maybe even some of the professional supports that they were already receiving. So for example, if there was a student that might have been receiving outpatient services within the school setting, right? With schools closing, there could be some interruptions in those services. And although a lot of the providers are really working hard to figure out how they can maintain the continuity of services right now, those look different. And, the student and the family may not necessarily be, receptive to some of those changes in services, or maybe there may be other barriers that could interrupt that. So I think, just kind of how all of the things that are affecting all of us, could be adding to, for those students that might have been struggling even before. I also think, something that we've been hearing about, we know that the majority of, the calls and the information that come into Childline are coming from mandated reporters that really aren't, in contact in the same way that they normally would be with some of our students right now. So I think some of the concerns that could be happening with issues of abuse or neglect, I don't know that there's a good handle on that right now if there wasn't already an open case. And I think a lot of schools are struggling to figure out, what can we do in terms of that aspect that could really be impacting our students right now. And then, of course, as we move forward in all of this.
Yeah, by the time this is probably put out there, this past weekend, I believe the Philadelphia Inquirer will have done a piece as far as children in trauma. And then I know in addition to that, the American School Counseling Association on April 6th, so probably be after we record, but probably before this is posted, there'll be a focus on children in trauma and another pop-up webinar, I believe. But these are really central concerns I think that we're hearing right now. I guess one of the questions would be, what are some of the common mental health concerns that we're hearing at this point that are impacting students? I know that we started talking a little bit as far as stress, the trauma piece as well. Are there any other things that we want to highlight?
I think one of the things that we don't often think about is that we're so good in schools on focusing on protective factors. We really focus on understanding that trauma happens and understanding that there are situations outside the school that we can't control. But in school, how do we build resiliency and how do we engage those protective factors? And right now, we as staff and our students and families have lost some of those natural protective factors that we are so good at naturally putting in place. I mean, educators as a whole are caregivers, and they take care of their students, they take care of their other staff members. And this is a time of loss. We're dealing with the unknown. They're missing out on events, especially our seniors or our students in career technical education who aren't getting that time in their shops where they're focusing on their hands-on skills and how do we navigate that and how do we engage in sports. And so the social connection piece is a huge loss, not only for our students, but for our staff who suddenly have had to adapt to a whole new way of being and have done such an amazing job. But we sometimes think about, we need you to do all of this, and we forget the fact that this is a time of loss for them. And figuring out how we do protective factors when it really is about social relationships over social distancing can be difficult.
And I think too, like, you know, like we're all collectively dealing with this right now. But, you know, the truth is that some may really be struggling more than others. And, you know, with the supports that were in place in our schools, you know, that provided, you know, help to some of those students in terms of generating coping strategies and different things like that. So now, you know, just with the current situation, you know, some may be seeking alternate coping strategies. And I think the challenging part is that sometimes those are going to be healthy. And as educators, we can help support with that, right? But, you know, some may be unhealthy. And I think that's something to be mindful of in terms of how this could lead to some other outcomes for youth that are.
Yeah. And I think this whole situation has really put a spotlight on the inequities across. And I always say this when I'm talking to schools or doing presentations, that, you know, there's amazing things about being a Commonwealth, but one of the frustrating challenges is that it is locally controlled. So the state can't come out and say every school must XYZ or every county must XYZ. And so it really is up to everyone to kind of figure it out, what works best for your community. And oftentimes that's a strength because obviously individual counties and districts know their communities so much better than a centralized state agency would. But that can bring up some frustrations. And I think it really is highlighting where some areas are able to do all these amazing things and they have instruction back in place and they're moving forward because they have a very small centralized location and they have the ability to do that, whereas other places don't even have phone lines or internet. And so being able to think about how moving forward we really think about the equity aspect of it, I just think is important as well.
I think as educators and just pretty much as citizens of this Commonwealth, we should take a lot of pause in realizing that whether a child is eating today or not simply depends on what their zip code is.
Yes.
Yeah, I mean, there are a range of issues. I hope that we can continue to highlight those and provide some practical strategies and resources because we understand like the matters as far as disparity in education. That is something that I think I've been appreciative that there's been more of a nuanced conversation during these school closures, but I would imagine that the actual real world issues, we're seeing just the tip of the iceberg at this point. With that being said, you know, like one of the things just kind of pivot to that. I mean, like Dan, you were talking about how we build those protective factors, but really, how can we foster resilience, or what are some of those stories of resilience that are out there right now?
I think that it's going to continue. Everyone's learning from each other, and so that is amazing. And there are clear examples of even statewide. PDE continues to put up resources on our webpage specifically focused on this. But one of the recent things that have come out is the coordination with the public television networks and the ability for schools who previously did not do online methods of instruction to have those platforms available at no charge to them. And that has been, that again goes back to relationships. So how we build those relationships. And I love seeing all the stories about relationships at a state level, but also at a local community level in the newspaper or on social media about just communities helping each other, whether it's students realizing that their elderly neighbors can't go to the grocery store and they go for them and do projects for them, or teachers driving through neighborhoods to wave to their kids, or there's Facebook groups that have been put up for families so that they can have interaction with the teacher and really working through the platforms that they have that used to be solely discipline, like Class Dojo, for example, and now they're really focused on positive relationship building. And so while there has been obviously a lot of down to this, one of the biggest things about resiliency that I think I've seen across PA is that everyone is focusing on that relationship building now. We continue to say universal relationships, and it's harder to do when you're in a school building and you're focused on increasing academics. But now it has become a central focus. And I think that is a huge resiliency builder, not just for our students and families, but for our staff who really miss their kids.
I mean, I do take a lot of appreciation that, like, historically, like, Pennsylvania has taken the lead when it comes to public broadcasting and providing that education for students. So shout out to PBS, Elmo, Zoe.
If Steve could get Elmo and Zoe on, we would never be on his conversations again.
You should have invited the two of them instead of us.
We have time at this point to have more of a nuanced conversation with a wide range of stakeholders. With that being said, as soon as we hang up, I'm going to get on Google and see what I can work out. With that being said, what are some other thoughts as far as supporting students through protective factors and resilience?
So one of the things that I think is really interesting that's happening now is just in terms of, especially for our school mental health professionals, I think we're really seeing this opportunity for a shifting of roles and a role expansion. As you know, there's been a lot of conversation just statewide for a long time now, just in terms of the concerns around ratios. And when ratios are not what they need to be, then roles get really restricted. So school counselors end up having to do a lot of academic counseling and things like that. School psychologists like Dana and I would be in positions where we're just bogged down with evaluations, and it just doesn't tap into the full skill set that these professionals actually have. And so in some ways, a silver lining of what's going on right now is that when some of these activities can't be done or they're just not the priority, it's like these professionals are having this opportunity to really expand what they otherwise would be doing and helping their schools figure out, crisis response or looking into prevention or supporting instruction in really innovative ways through virtual modalities and doing coaching and consultation. And just really being able to address a lot of the things that they don't get to do. And I think, a hope would be that things, of course, when school does eventually go back, I think that there will be kind of a backlog of different things that, were on hold during this time. But, perhaps it's an opportunity that, administrators and others that don't always get to see, the value of these professionals in their schools might really get a great taste of that during this time, and perhaps at least some of that hopefully would be able to carry forward.
Yeah, I think particularly like now during school closures and really during the stay-at-home orders, when so much has been stripped away of everything, whereas it creates a lot of chaos and confusion, and also provides some clarity for some pieces as well. Just speaking to both what you're saying, like a refocus on the relationships as those core aspects of education, providing those social emotional skills, and really equipping like our student support professionals to be leaders to help to guide some of those conversations. I think those are some really powerful and resonating messages that I've been hearing from across the state, from every level. And those are some things that I think we want to continue to highlight those discussions, and also continue to complement and provide those tools so that we can both be as effective as possible. What are some of those supports and tools that you're hearing on how schools or communities are responding during like the stay-at-home orders and during the school closures?
So, and I can just kind of mention, because it sort of taps in even to some of the resilience that we've been talking about, but during this time, probably a lot of people that would be watching this are familiar with the fact that the state has really been promoting some of the crisis resources. And in particular, the Office of Mental Health and Substance Abuse Services, where I work, we have a partnership with Crisis Text Line, which is a national service. A lot of schools are really familiar with that. And we do have a unique PA keyword. So if you text PA to 741741, then that information, we have kind of access to aggregate data. And what we've heard, which I think is really, really remarkable, is that Crisis Text Line has shared back with us that there's been a surge in the number of texts coming in using that PA keyword. And so people are really accessing this resource. It's a resource that's just available for anyone struggling with any kind of situation. It could be a crisis situation. It could just be that someone's feeling overwhelmed, stressed, anxious. It could be that they're having relationship issues. It could be that, a trauma occurred. It could be that they're thinking about suicide. And the counselors on the other side of the line, or the other side of the texting conversation, are able to basically move that person from a hot moment to a cool moment. And if they have to, they can do a risk assessment all through text, and sometimes even do an active rescue. So we know that that resource is being utilized just even in the last few weeks, as it's been more heavily promoted, which is great to see. And anecdotally, I can't really speak statewide, but I've heard from a few contacts that work more in crisis and in hospitals that they're seeing less on the side of like referrals coming in for youth in crisis, which I think is a really interesting thing that's happening right now. And so it's not to say that that's happening statewide, and certainly I think part of that is due to the fear of hospitals right now in the midst of COVID-19. People are wanting to avoid that, but somehow, youth and their families are being resilient in terms of finding ways to kind of cope with some of these crises, to the point that they're not ending up in hospitals, at least right now. So I think that's interesting. I think we'll it's likely that we will see a change in that over time, but just something I wanted to mention, just as perhaps a result of some of the other resources that have been pushed out that people are able to access right now.
And I think in addition to
I'm a big fan of the Crisis Text Line, and I love the support that they're providing. I'm not positive. I didn't have a chance to do it, but if you're a data nerd like many of the people on this call are right now, what's also great is from like a research side, it provides a lot of information back on the calls. On the text, and at least talking to one counselor who posted out from Philly, Nakia Washington, she had been looking at it, and the #1 trending word in the text recently has been school, which resonated to me.
And we are, that definitely resonates. And we are hoping to be able to gain access to a dashboard that's even more expanded than we have now, that would give us more of that data, demographics, geographic location, to really help us understand the trends that we're seeing. The other thing, if you are looking for something else to be doing right now, I know that they're really significantly expanding their volunteer base. It's a really quick application, and they can do like a 2-hour, training period if you do it intensely. Otherwise, it's like a 6-week training period. But you basically have to commit for about a year, 200 hours, and it's like a minimum of 4 hours a week. So if just putting it out there if people are interested in volunteering and helping in that way too.
Perri, if you email me that stuff, I'll add it to the resource page whenever we post this, but that'd be appreciated.
Sure.
And I decisively won a game of rock, paper, scissors, but I want to defer to the second place contestant at this point for any additional comments. Dana.
Okay, I lost. It took me a second to realize we were playing rock, paper, scissors, so I lost. So I just, in addition to, I think, what Perri's talking about, one, to expand on the crisis lines, I think two of the things that have come out that have been just much more promoted is the focus on the teens, so that teens have an ability where they're speaking to other trained teens and adolescents, and they feel safe doing that. Those are obviously more for our kids. If we were doing the 1 to 10, where am I, they would not be our 10s. But when that stress level is rising and they're stressed out and they just want someone else to talk to, that's important. And the LGBTQ focused crisis lines, I think, are also really important, and they have been highlighted more, especially in this time, because a lot of our students have come out to members in their school communities and their parents know nothing. And that has been something that I think we've really, I've sent to several rural schools that I had been working with, because I know that those were conversations that we had where they didn't feel safe because of the climate in their community to be open about who they were in their community, but they were very open and had those relationships in school, and that's where their support came from. So making sure that specific focus is there and that they feel safe talking to someone and not feeling judged, I think, is really important, and has been, a focus of some specific crisis lines. So the difference in seeing individuals come out for crisis lines on very particular demographics has been really important, I think.
Just so I know, as schools, we continue to try and foster and create these safe spaces. I guess one question I would have is, as we are distanced from each other right now, how can schools create culture, create community, or how can schools be collaborative or proactive in supporting their students right now?
I think one of the things that just really creates that community and safe space as we all deal with a new normal for right now is reaching out, proactively reaching out to families, and understanding that they're in the same boat, and thinking about the culture that and the climate you're creating on those phone calls, that it's not a phone call to say, is your child doing XYZ number of hours per day of schoolwork, but we're here for you, we're in this together, and we want to be able to continue to support you as a school, and really connecting as schools with our community partners and organizations so that we can provide resources to our families.
Yeah, I think that one of the other pieces is, kind of thinking about what supports are available in the school as well as in the community. I think that we can have schools be thinking about that in terms of right now, as well as how those services may have changed during this time. So if you have community partners that you would otherwise be working with, are they operating right now? And what do their services look like? Do they have full staff? Have they moved those services online? Kind of figuring out what's available. So it's almost like this resource mapping process that you could potentially be doing now to understand how, those partnerships could support your current efforts. And then I think that it also makes sense to really be thinking about, for whenever school does resume, right? Where are the gaps, in some of those resources, just based on the conversation we had a little bit earlier around, the increased stressors right now, how we could potentially be seeing some mental health concerns that get exacerbated during this time. Whenever school does resume, there may be an increased need for supports in some way, shape, or form. And so how can schools be proactive there in trying to identify those gaps and potentially reach out and figure out what those needs might be and be able to plan ahead for that.
Yeah, I guess let me just ask you that question. Like, how can school teams partner? How can school teams collaborate to support students either through the school closures or when students re-engage in school?
I think really, I mean, and we've had a focus, and one of the nice things about Perri and I working together so much is that we're able to do that mental health community and school partnership at a state level and really talk about communities and the same conversation with communities and schools and have it on both sides, like in the school and on the mental health side. And that is important, like Perri said, really looking at the resource mapping, not an extensive process, but taking a basic, this is what we need, this is what we find as a school we're spending most of our time right now on, and how do we see those gaps and where can we go? Like, what is in the community? I think, it ties back into the resiliency piece, but community agencies as a whole are really receptive right now and looking for ways to support schools, looking for ways to support the students in their community and how they can expand their practices to be able to do more of that support. And so I think it's a good time to develop those relationships, even if it's a phone call, a Zoom meeting, a brief conversation of, okay, as a community, I might be overwhelmed right now, but let's talk about how we continue this when school starts. When we all return to our sense of normal, how do we continue this relationship so that we're filling in the gaps that Perri talked about before?
I think there's probably also some, internal school teaming that could be looked at right now, right? Because, as a school, if you haven't had a situation where a student has been at increased risk during this time yet, it's pretty likely that you will face that at some point, during this time. And so just recognizing that may happen, I think it's, important to think about what is going on with your existing teams. If they're not operating right now, then what are the mechanisms that you would have in place to be able to monitor those students and follow up with them when school, does resume. And so, if you're outside of your regular teaming structures and, as a counselor, for example, you're interfacing with a particular student and there's an issue, thinking about how that's going to get documented, what the mechanisms for communication are going to be and notification of teams, how that will eventually interface with a teaming structure at some point, thinking about, those different pieces so that those students aren't falling through the cracks. And, unfortunately, we've also heard of some, situations where, there have been losses, and there will likely be more losses, between now and when we go back to school, whether that's, family members of students or whether that's actually students. And that could be, due to illness, due to accidents, due to suicide. So, in the midst of kind of this larger crisis, there are these other crises that are going to be coming up if they haven't already.
Mm-hmm.
So how are those going to be addressed? And so do schools need to be thinking about existing policies and procedures and how those are going to be put into place right now? What aspects of those may look a little different? And especially when it comes to something like a loss, figuring that out in the moment is less than ideal. So if there's any way for schools to be proactive there, and it's not what we want to be thinking about, but I think it's a reality. And I think, schools will be much better off if they're able to think ahead and plan for some of those things in advance. And that also ties back into the community partners piece and reaching out and having those relationships and figuring out who is available to support with this if this is something that we experience during this time.
Yeah, we started this week just revisiting our own district level response team, and we're trying to look to collaborate with our own intermediate unit. Just real quick, we're covering a lot of grounds, and clearly I know that you two have spoken for days about these different topics, and I've been bending your ears for at least hours about these as well. What are some of the state level resources that you continue to kind of foster and develop and push out to?
Well, PDE does continue to develop resources to assist schools and provide those supports, and we're continuing to focus on that. And I think now that the continuity of education that has been put out and some of the basic like logistics have been handled that needed to be addressed first. You know, it's kind of, if you think of like Maslow's hierarchy for schools, you've got to address the food safety and basic education and connecting with students first, and then you can think about other things. And so we're working on developing some resources related to more school climate, supports for home, supports for staff type of documents. So the webpage will continue to be updated with those types of documents. And Patton has also updated information related to the coronavirus and specifically focused on special education and behaviors, but that's another resource as well. I know that Perri is probably more familiar with the WARMLINE that just came out, so I'll let her talk about that one.
Sure. Yeah, so actually this just got announced yesterday, in fact. You know, different counties actually do have their own WARMLINEs, but we now have a statewide, it's called the Support and Referral Helpline, that's available 24/7. And that's being run out of Butler County, out of their Center for Community Resources. I can say the number now, and then Steve, I can also share it with you, but it's 1-855-284-2494. And really this is, you know, skilled, trained staff that are available any time of day, like I said, 24/7. And it's not a crisis line per se, but it's to really help individuals throughout, you know, the state that are struggling with anxiety, struggling with other difficult emotions during this time, and being able to, if there's a need for some emergency, you know, supports, they have ways of making those connections and also referring for community-based resources. So this is an effort that, you know, the state worked pretty quickly to try to put in place. So we now have that, but then we also still have our county crisis lines that, you know, every county has that. Some of those are affiliated with the National Suicide Prevention Lifeline, and that number is 1-800-273-8255. So that's always a number that can be called, as well as if you have your county crisis lines, in addition to now this WARMLINE. As I mentioned before, another important resource, of course, is Crisis Text Line, and that's text PA to 741-741. And then Dana had mentioned before, there are some dedicated crisis lines for LGBTQ youth. And one of them is run by the Trevor Project. It's a national organization. And so they have their Trevor Lifeline. And that number is 1-866-488-7386. And so, Steve, I'll make sure I share all of these with you after this.
Just to anyone listening right now, I do want to be clear that Perri has every phone number memorized, and that in addition to that, she doesn't keep a cell phone. She still just walks around with a pocket full of quarters and calls people from memory, completely 80s style. But that's a wealth of resources.
Those numbers from a page, by the way.
Sure, you were.
I know a couple of them by heart.
With that being said, we'll make sure that all these resources are posted on our page for our listeners.
Really quick, I wanted to just mention too, like, just even though this isn't necessarily school staff, but the Office of Mental Health and Substance Abuse Services has really relaxed the guidelines and requirements for telehealth. So as, you know, a school counselor or whoever's watching this, you know, you probably have heard about that already. But, you know, for a temporary period of time, it makes it a lot easier to support that continuity of services. And it applies to services that otherwise wouldn't necessarily have been eligible for telehealth, you know, different modalities and things like that. And I know the provider community is really working hard to make sure they're quickly moving into that realm, to be able to offer that as widely as they can. So, you know, for the school audiences that could be watching this, that's just important to know about. And there is information available at the state level to provide more details about that too.
Any last closing thoughts? I mean, there's tons, but.
There are tons. I think my last closing thought would just be that everyone needs to give themselves a break. that everyone needs to realize we're all going through this. We're all going to have amazing days, and we're all going to have days that are horrible. And it's okay, and you reset. I know yesterday was one of my horrible days, and I texted Perri and was like, I am off today. So every meeting I'm in, I'm just going to like, I'm not having an okay day. And being honest about our emotions and saying that, because we can't, especially with the main audience of this group, when you're a helper and you want to be able to fix and you can't, it sometimes really weighs on you. And so being able to say, I need to take a step back and I need to let other people know I'm not okay, that I have to take care of myself and I have to ask for support sometimes, is something that we struggle to do in the mental health community sometimes. And that would be my takeaway, is that being transparent, not only as an individual, but if you're talking schools, you're talking staff, it's okay to say to parents, we're having a hard time figuring out how to do this. It's okay to say to other staff members, I don't know how to work this technology, I need help. And so this is a time where I think we all need to just be more patient with ourselves as we're working on being more patient with other people.
Yeah, I could not agree with that more. You know, I feel like I'm hearing from everybody and also personally experiencing that this has been, you know, the hardest week yet in all of this. And, you know, it's hard to say what's going to come next. I mean, there is so much unknown that we're all dealing with right now. You know, obviously self-care is so important, but it is easier said than done, especially for us in the helping profession, as Dana said. And so, you know, I think whatever ways we need to be setting boundaries and figuring out how we can prioritize that. I feel like we're getting bombarded with all kinds of strategies and suggestions and resources, and it's all great and it's all well intended, but it is information overload. And so I think, you know, finding time to just step away from that and, you know, just be able to really figure out, you know, what it is that we can all need, or we all need to be well in this time is just something that has to be at the top.
Mm-hmm. The last question, just which goes right off the Dana and Perri, what are you guys doing for your own self-care?
I think I'm still figuring it out. I was trying the first week to like be really good about limiting like a cutoff time for work, and that just feels like it hasn't been as easy to do over the last couple of weeks, and it just kind of all blends together for me. So, I mean, I think that one of the things that's made me feel the best has been just like connecting with friends and family and doing those video chats and doing those. It was my husband's birthday last weekend, and we had this big, you know, virtual party, and that was really fun. So I think that has been something that's made me feel really good. As much as I don't like it beforehand and don't feel like it, I think whenever I found the time to exercise and find little like YouTube videos, even if they're like 20 minutes or something, I feel really great after. So I think that's something. And then like for me also just finding time to get outside. It's getting really nice out and it's hard to be cramped up in the house all day. So those are some things that I'm trying to do.
I'm limiting how much time I'm on reading stories about everything that's happening. I'm definitely spending more time outside, and I'm lucky enough to volunteer at a horse rescue, and so the horses continue to need taken care of. And we have been very careful about who can volunteer and who can't, because a lot of our volunteers still are essential personnel and interacting with a lot of people, so they can't come out. So we make sure we keep everyone safe. So my volunteer hours have increased, and spending time outside being active, and as weird as it sounds, smelling a horse makes me feel so much better. So I know that sounds really bizarre, but so that's, I've been doing a lot of that. And really this week I've just been focusing on like out loud telling myself that it's okay not to always be okay.
I've been trying to cook more. I've had very few incidents so far. And yeah, qualitatively, whenever it's sunnier out, I'm doing a lot better with those days. But I want to thank you guys for all of your time and your expertise. Maybe we'll try and redo this in a couple weeks as things just continue to evolve. And I know you're just rapidly developing more tools and resources. So maybe we'll connect a little bit. But most importantly, we want to thank everyone for listening. I'm Steve Sharp on behalf of the Pennsylvania School Counseling Association. Please stay safe, stay healthy, and stay connected. Thank you.